You place the child in a supine position with the head in midline, then gently stroke the infant from the lips to the cheek. The response will be turning the head to the side. The normal response of a 6-month-old would be no presence of the reflex. The abnormal response of a 6-month-old would be the presence of the reflex.
For the Moro reflex, set up the infant laying supine with their head at midline, support the head and pull the infant halfway between supine and sitting. The stimulus is to allow the neck to drop and the neck muscles to stretch. The response would be shoulder abduction, elbow, wrist, and finger extension. And since our infant is 6 months old, this would be present. Normal response is present.
Crossed extension. The position is supine, head in midline, lower extremities extended. The stimulus is holding one leg in extension at the knee, applying firm pressure to the sole of this leg. And then the response is flexion, then extension of the opposite leg. The normal response for a 6-month-old would be no reaction.
For the flexor withdrawal reflex, you start with the infant in supine, head at midline, with lower extremities extended. You apply a noxious stimulus to the sole of the foot. For a 6-month-old, the normal reaction is going to be that there is no reaction. But if there is a reaction, then that would be abnormal since this one is integrated at 1 to 2 months.
For the neonatal positive support lower extremity reflex, set up the infant in a vertical position and support them. The stimulus is to allow the feet to make firm contact with the floor or table or support surface. The response is a co-contraction of the leg muscles, but they are not able to support their body weight. Since this reflex is integrated by 1 to 2 months, that would not be a normal response for a 6-month-old infant.
Spontaneous stepping. The position is supported in the vertical position. The stimulus is feet touching a hard surface. Incline the infant and gently move the infant forward. The response is stepping motion in the legs. And then an abnormal response for a 6-month-old would be no reaction.
The stimulus is to turn the infant's head to one side. The response will be extension of the arm and leg that the head is turned towards and flexion on the opposite side. The normal response of a 6-month-old would be to show this reflex, and the abnormal response would be no presence of it. The stimulus is placing the infant in a prone position. The reaction would be a flexor tone and feeling resistance to extension of the elbow. Another stimulus is placing the infant in a supine position, and the reaction would be an extensor tone and feeling resistance to flexion in the elbow. The normal response of a 6-month-old is showing the flexor and extensor tone, and the abnormal response would be no presence of this.
For the symmetrical tonic neck reflex, you place the infant in the quadruped position and passively flex the head forward and backwards. When the head is flexed forward, you should see flexion in the upper extremity and lower extremities should be extended. When the head is extended, then you should see extension in the upper extremity and the lower extremities should be flexed. This is a normal reaction in an infant of 6 months.
The stimulus is placing the infant in a prone position with the chest touching a surface. The response is the extension of the head into an upright position. Another stimulus is placing the infant in a supine position with the shoulders touching a surface. The response would be flexion of the head into an upright position. The normal response of a 6-month-old is to perform both of these actions. The abnormal response would be no presence of the reaction.
Neonatal neck riding, or NOB. The position the infant is in supine with the head in midline. The stimulus is to turn the infant's head to one side, and the response would be to turn the body so that the trunk follows the neck. An abnormal response in a 6-month-old would be moving as one unit, and a normal response of a 6-month-old would be dissociative movements. Neonatal body riding, or BOB. The position is supine with the head in midline. The stimulus is flex one limb over the chest and rotate the limb across the body. The response is that the upper trunk rotates to the same side. And then an abnormal response for a 6-month-old is moving as one unit, and a normal response for a 6-month-old is dissociative movements.
The stimulus is supporting the infant in the air. The response will be when the head extends and the back and hips extend in sequence. The abnormal response of a 6-month-old would be no presence of the reflex, and the abnormal response would be the presence of it.
Protective extension reflex includes 4 separate reflexes. The stimulus for each is an unexpected balance shift. The response is extension of the arms towards the direction of movement. The first is downward movement, and the onset is 4 months, so this would be seen in a 6-month-old infant. The second is forward. The onset is 6 to 7 months, and this would be seen in our 6-month-old infant. Third is sideward. The onset is 7 months, so this would not be seen in our 6-month-old infant yet. And the last one is backward. The onset is 9 to 10 months, so this would not be seen in our 6-month-old infant yet. Notice that the arms extend in the direction of the movement.
Tilting. The position is prone, the stimulus is tilting, and the response is to elongate to the weight-bearing side and shorten the contralateral side. The normal response for a 6-month-old is to have the reaction, and the abnormal response for a 6-month-old is to not have the reaction. Tilting. The position is supine, the stimulus is tilting, and the response is elongating to the weight-bearing side and shortening the contralateral side. The normal response for a 6-month-old is to not have the reaction, and an abnormal response for a 6-month-old is to have the reaction. Tilting. The position is sitting, and the stimulus is tilting. The response would be extension of the weight-bearing side and flexion of the contralateral side. The normal response for a 6-month-old would be not having the reaction, and the abnormal response for a 6-month-old would be to have the reaction.
For the tilting and equilibrium reflex in quadruped position, the stimulus is placing the infant in quadruped position and tilting them on a tilt board or other inclined surface. You can tilt them in the lateral angle, in the anterior angle, or in the posterior angle. The expected response is to see an extension in the weight-bearing side and flexion in the opposite side. Since the onset of this is not until 9 to 12 months old, the presence of this would be abnormal in a 6-month-old. For the tilting and equilibrium reaction in standing, the stimulus is placing a infant on their feet on a tilt board or other inclined surface. When they tilt to one side, they will extend the leg on the weight-bearing side and flex the leg on the non-weight-bearing side. This would be an abnormal response in an infant because the onset of this is 12 to 21 months old, and most 6 months old cannot stand yet.